Even though changing diapers might feel mundane and routine, it is very important for building relationships with the child. Taking your time with this important task ensures proper sanitation and relationship building. First, you should get organized. If you're using a disposable cover, place it down, making sure it is large enough to cover the area that could be contaminated. Get the new diaper and enough wipes for the change out of the box, keeping the box close by in case it's needed. If diaper cream is needed, put a small amount on a tissue and set it aside for use later. Have a plastic bag available for soiled clothing if needed. Put these items on a separate surface or at the child's feet. If it is program policy or you choose to wear gloves, put them on now. Bend to the child's level and tell them you're going to change their diaper, and hold out your hands to pick them up. Wait until they respond before picking them up. Tell them you're going to put them on the changing pad or surface, and then do so. Continue telling them each action you're about to do throughout. And remember, always keep a hand on the child throughout the diapering process. If the clothing is soiled, remove it completely and place it in the plastic bag without rinsing. Close the plastic bag to send home with the adult picking up the child. Unfasten the diaper, pull the front of the diaper down over the soiled portion and under the baby. Wipe the child front to back with a new wipe for each pass on the child's body. After wiping, you may either dispose of each wipe into the soiled diaper or into a plastic-lined, hands-free covered trash can. Once the child is clean, throw the diaper into the trash can. If gloves were used, remove using the proper technique and dispose of them. While you are unable to have a hand on the baby, stand extra close and keep a very close eye on them. Use a wipe to remove soil from your hands, even if you don't think they are dirty, and throw it in the trash can, and do the same for the child's hands. Put a clean diaper under the child. Apply the cream set aside earlier if needed, and redress the child, telling them what you are doing. Move the child to the sink and wash their hands. If they are very young infants who do not have sufficient muscle control to safely be held over the sink, you may skip this step. Following proper hand washing procedure, be sure they wash for at least 20 seconds. Then, place them back in the play area. If the child had soiled clothing, label the bag with the child's name and add it to the things that need to go home with the child. Spray the diapering surface with a soap and water solution and wipe dry with a disposable towel. You will be cleaning and sanitizing the changing pad, table, and any other surface that came in contact with the changing pad or the child. Then, spray the surfaces with bleach water solution. Wait 2 minutes. While you are waiting for the sanitizing solution, wash your own hands using proper hand washing procedure. Then, wipe the changing surface dry or allow to air dry. And finally, record the diaper change on the daily sheet. These procedures should be posted prominently in the diapering area. Be sure they meet the most up-to-date requirements of your regulating and health agencies.